It's no surprise, really, to anyone that nurses have really shown up in ways that we all recognize. But there's also this inherent tension between being rated as the most trusted and the reality of how many nurses are practicing in their work environment. So today we want to really re-examine this relationship and the framework for how we engage with the public so that we can make sure that we actually have a sustainable workforce. And how we do that as partners and allies with the public is part of what we want to talk about today.
We think it's important to take a step back and look at the state of healthcare and the state of the nursing workforce prior to COVID. We recognize that things were not well even before COVID. It's just that COVID really amplified some of the shortcomings that we've been dealing with for many, many years. And we also need to recognize that there are societal factors that influence the delivery of healthcare, influence the education of nurses, and influence the interaction between nurses and the public. And so, we think about in the decade leading up to the pandemic, we had movements like the Me Too movement. We had things like Brexit. We've had a lot of other social upheaval in various parts of our nation as well as the world that all have impact on the delivery of healthcare and, of course, nurses, because we are the largest number of providers within that system. And while it's important to think about the impact on nurses as a profession, we also have to think about the individual impact these factors have on nurses themselves.
If you think about what happened early on in COVID, there was a lot of, hand clapping and, nurses are heroes. And yet, even though that may have been well-intentioned to acknowledge what nurses were doing, I think many nurses felt offended by the ways that kind of a response felt like it was putting them on a pedestal that they did not want to be on, first of all. And second of all, that it felt as if it was denying their humanity, that somehow nurses were expected to be heroic. We know nurses worked during COVID when they were sick. We know that nurses died from COVID, and over a third of the deaths in healthcare professionals were nurses. So this idea of self-sacrifice really came into the fore as an assumption that, in a way, nurses' service was taken for granted. But what was disturbing during COVID, I think, was for many nurses, our fuel is our patients. And when we felt that our patients were turning against us, either by physical, verbal violence, or were questioning our commitment or our truth-telling about what was happening in the healthcare environment, it really eroded our sense of why we're here. And of course, alongside that, we have seen the degrading of our workforce. The National State Boards of Nursing reported over 100,000 nurses left the workforce after COVID, and over 600,000 are expected to leave in the next few years. So this whole sort of context left Eileen and I wondering about what would happen if there were no more nurses, and how might we be able to deliver care? How could we sustain our healthcare workforce in the midst of these challenges?
As you and I have talked so often, and as we sort of dove into this conversation, we really started to think about how that relationship has been described historically. And one of the things that we often hear is this term that, nurses have a social contract with the public. And I really wanted to understand what that meant. So I really kind of dove into that a little bit farther. And when we think about this social contract perspective, what that usually means is that the public agrees to allow nurses to determine what their practice is, to determine how one becomes licensed as a nurse, to determine how we hold one another accountable for our practice. And then at the end, the sort of the public act of that is to give us that permission, so to speak, to develop ourselves as professionals, as licensed professionals. And then, of course, the flip is that we as nurses will provide care and it will be of a certain quality. And, you know, given all that has occurred, and not just again with COVID, but leading up to COVID and some of the other things that we've seen just historically in the way that nursing has been supported and addressed, and whether or not they've been given the resources that they need to do their jobs. I think we need to step away from that language of using the term social contract, because the relationship that nurses have with the public is much more than simply you can care for me if I give you the opportunity to be licensed and protect your title and protect your profession. What really better describes the relationship with the public is really a promise, and it's a bi-directional promise. Nurses enter into the most intimate spaces with patients, and there's a level of trust that occurs, and it's bi-directional. And so when we talk about covenant, covenant harkens back, millennia, and it really is really stands for almost a moral promise that occurs between two parties. And I want to make very clear here that I'm not referring to sort of that virtue narrative of nursing, that nurses promise to always take care of patients and so forth. But what I really want to emphasize, that this is a promise that is between two parties, nursing and the public. And so nurses certainly promise to provide, the best quality care for the patients, but there is a piece that the patient provides as well.
So what would it be like to be able to say, when someone asks you, what do you do? To stand proud and say, I am a nurse.
Thank you for watching this webinar preview. My name is Julie Cullen, the managing editor of American Nurse Journal. I invite you to watch the full version of this free on-demand webinar. Just follow the link in the description. You can also visit myamericannurse.com for a full collection of our free webinars. Thank you.